In the last video, we recorded the registration workflow. In this demo video, we will record the clinical workflow of the patient. This is the home screen of Bamni. After the patient is registered, he will go to the clinical department where he will see the doctors. So once he is in the clinical department and a new visit is opened for the patient will be available, will be visible in this patient queue, or we can search for the patient by using the patient ID. So this is the patient we created. So this is the patient dashboard. All the fields in this patient dashboard are configurable. All these display controls, as we call them, are configurable to for a specific hospital, keeping in mind the data they want to see. Now that the patient is in the doctor's office, so the doctor will click on consultation and start the clinical consultation for this patient. What we see here are the disease templates or disease forms, as we call them. These forms are configurable, and the doctor would be using these forms to record the history and examination of the patient, or the vitals, or any specific disease related information. Now all these forms are configurable according to the needs of the hospital. What we see here are demo forms which come pre-loaded in the Bamni system, but the hospital has the ability to configure it according to the data they want to capture. What we see here are the additional disease forms. Say if it's a tuberculosis patient who is coming for the second or the third time for a follow-up visit, so the doctor will select this kind of a form to record all that information. Let's start recording the patient information. Let's say the patient is complaining of cough for the past 3 weeks, and the patient also complains of fever for the past 2 weeks. We can also record additional notes with each of the chief complaints, which, let's say, mild fever in the evening. Any other chief complaint notes or history notes we would want to capture for the patient. Smoking history. Let's record the vitals of the patient. Say the pulse is 72. Blood pressure is 130 by 90. Now, since 90 is out of the normal range, so we see that value in red and abnormal checked in for the patient. Say the temperature for the patient recorded is 99 and respiratory rate is 24. Say SpO2 is 89. Now we suspect that the patient might be a tuberculosis patient, so we would start recording the tuberculosis intake template since the patient has come for the first time. So if the patient has any comorbidities, we may select the different comorbidities available here. Say HIV or diabetes. If the patient is already on a treatment plan, or which treatment plan we would want to give to the patient. select this treatment plan and the date of next follow-up visit, say after 15 days. The patient should be coming for the next follow-up visit, so we'll select a date. If the patient needs to be admitted or not, history of contact with family, if the patient is on TB treatment, has been on TB treatment in the past, the type of tuberculosis suspected, any extrapulmonary TB site suspected, or the X-ray findings for the patient. And then after recording these, we go to the next tab to record the diagnosis of the patient. Whether the diagnosis is primary or secondary, or whether it is a confirmed or a presumed diagnosis. Let's say this is a presumed diagnosis. Now we can also give a disposition to the patient if we want to admit the patient or discharge a patient or transfer the patient to another ward. We will come to this flow in another video. On this tab, the doctor can view whatever consultation notes he has recorded for the patient, or any additional notes if he wants to record. He can enter them here. The orders tab, here the doctor can order the lab test for the patient. We have different samples from which the lab test can be recorded. So clicking on that will open the pertaining lab test for that sample. So let's say the patient has been given CBC, TLC, DLC. Selecting on one panel selects the relevant tests which come under that panel, and the selected orders are visible here. These are the radiology orders. Let's say the chest X-ray is recorded for this patient. Since it's a TB patient, we order a chest X-ray for the patient. And in this tab, we can prescribe the drugs for the patient. Here we can choose the dosage of the drug, how the drug needs to be taken, and till what time it needs to be taken. It will calculate the number of tablets to be dispensed. Add this to the patient's prescription. Similarly, we can add more drugs to the patient, and we click on save.